Today we'll discuss the hemolytic anemia, the differential diagnosis of hemolytic anemia, history taking, physical examination, and investigations. The differential diagnosis in hemolytic anemia is a thalassemia, G6PD deficiency, autoimmune hemolytic anemia, microangiopathic hemolytic anemia, hereditary spherocytosis and elliptocytosis, and sickle cell anemia. The history in cases of thalassemia, the alpha thalassemia is common in Southeast Asia and Africa, while beta thalassemia in Mediterranean people. G6PD deficiency is common in African, Asian, and Mediterranean. The one important point in the history is also the patient would give the history of episodic hemolysis under oxidative stress, and also the family history because it's X-linked recessive. The autoimmune hemolytic anemia is idiopathic or could be associated with other autoimmune diseases, infections, or lymphoproliferative disorders. Microangiopathic hemolytic anemia. There are many differential diagnoses in case if we suspect the microangiopathic hemolytic anemia. These are the TTP, HUS, DIC, eclampsia and HELLP syndrome, malignant hypertension, vasculitis, malfunctioning heart valves, metastatic carcinoma, some drugs, infections, and anti-phospholipid antibody syndrome. So if we suspect TTP, there would be the related history of HIV or drug use. In hemolytic uremic syndrome, the diarrhea that is related to cytotoxin. In DIC, infection or emboli history. So in every case, we'll try to find the relevant points in the history. The spherocytosis and elliptocytosis are autosomal dominant condition, and sickle cell anemia can present as sickle cell disease or sickle cell trait. In the physical examination, anemia, so the patient would present as pale and look anxious. There could also be splenomegaly and the leg ulcers. In investigations, blood film, antibody test, and molecular analysis are the important, and hemoglobin electrophoresis are the important points. In thalassemia, hemoglobin electrophoresis gives the diagnosis in G6PD, Heinz bodies, and G6PD assay. In autoimmune hemolytic anemia is spherocytosis and agglutination, and direct Coombs test would be positive. In microangiopathic hemolytic anemia, schistocytes would be found in the blood film, hemoglobinuria, hemoglobinemia, hemosideриnuria, and hemolytic workup are important. Molecular analysis in cases of spherocytosis and elliptocytosis, and sickle cell prep and hemoglobin electrophoresis if we suspect the sickle cell anemia.